Thank you, Sylvia. We have one more, last but not least. Paul and Darlene will present philanthropic with higher ed.
Thank you. Paul and I were part of a very rich discussion yesterday of exploring a business case for philanthropic and higher education investment in high-value CPD. And it was clear from the beginning that there were several disconnects. And the first was about the words. Some felt in the group that the word business in developing a case of support might not be seen as negative, but not be appropriate for all audiences. And so there was discussion about wording and building a case of support. And the other disconnect was an understanding of how philanthropy thinks and how higher education thinks. And we sort of, are not on the same plane of discussion. And really, most of our time was spent on that. The business case was sort of the backdrop, and we'll discuss that a little bit. But it was really this understanding of philanthropy and higher education. And I'll just say that I am only speaking from the perspective of my organization, which is a small family fund. It's private. We have a living donor, and it's multi-generational. So it's very different from an organization where the founder passed away 50 or 100 years ago, and it's being run by a professional board. I mean, we have a professional advisory board, but the family earned their money, and when there's grant making, it comes out of their wallet. And so it's for everyone applying for funding, it's just, you really need to know that and do your homework about what kind of philanthropic organization you are speaking to, and what their mission is and what their values are. So the other disconnect was that philanthropy might be seen as not having a business mentality and not seeing things from a business case point of view. But that's changing, specifically with family organizations, family foundations such as the Gates Foundation, Michael J. Fox, Zuckerberg, et cetera. So that mindset is really changing.
You'll notice how seamlessly we work back and forth on this. So Darlene, how does your organization decide if the grant is a go or no-go?
We require a business case from day one, and if Paul is approaching us for funding, that's it. Like, that is the first thing. I need to make an 8-point one-pager for my family and for my advisory board. Here's the business case. Do you want to talk to this potential grantee or not? Yes or no? So, Paul, what about higher education? How do you decide if it's a go or no-go?
The money needs to come from a source with values that match the values of our university and our CPD program. Commercial support, for example, in continuing medical education, has high visibility guidelines. But there are other questions that are more difficult where guidelines may not exist. So I can point to an example for our university, especially around accepting tobacco money. The funding also must be sufficient to enable us to succeed in completing the CPD project at hand. We want to be able to dig deep into the outcomes model of your choice to see whether we're doing good. And then ideally, the funding source may become a stronger long-term partner, helping us to improve relationships with patients, with the health system, and the communities.
You're mentioning sort of a match between the goals of the organization and the funder. And just a funding point of view, the goals don't have to be the same, but they can't be in conflict. I think, Lucy, you mentioned that yesterday when you were talking about partnerships. And so both the funding organization and the recipient need to have goals that are not in conflict, focused on the beneficiary first and foremost, but they can be different. So we're going to quickly go through our case. So we're funding a low vision and blindness initiative, and the goal is to eliminate children's blindness. It's a funding partnership, $2.5 million from the Jonas Family Fund and $2.5 million in a match from a university academic medical center. There are 5 program objectives: doubling the number of children receiving care by 2021, increasing the number of clinicians, nurses, scientists pursuing careers in pediatric ophthalmology, vision science, and visual rehab, and that's through fellowships. That's the CPD part of this grant. We're going to be disseminating the research that comes out of the grant, outreach, and advocacy. And it's over 5 years, which was an interesting point that we were talking about yesterday, the importance of it having that much time.
So the question of how CPD units in higher education can benefit from working with a philanthropic organization, we can have several benefits. One, we can do meaningful work producing a high-value program with high-value outcomes that address the mission of the funding organization as well as the mission of our university. Another is that we can demonstrate rapid success, solving immediate problems more quickly using the healthcare practitioners that we have in the currently in the workforce, instead of waiting for the pipeline to bring us a set of skills to solve the problem longer term, but also conditioning and facilitating that pipeline. It enables us to build capacity for further carrying out similar work in CPD. It enables us to specify measurable objectives for determining progress and relative success. And it enables us to pay the bills. It also gives us an opportunity to build new relationships with partners, patients, health systems, and communities. So I will be returning often to the notion of building evidence, and these kinds of projects, a 5-year project, gives us an opportunity to track performance over an extended period of time, helping us to identify or explore causal linkages that often are not available to us using other designs.
Our time is up, but one word about sustainability, which was very important in our group, just from the point of view of this grant and from our foundation. Sustainability is one of the first questions on the business case at the very beginning. So the philanthropic investment is phase 1 of a project, then there's phase 2 and phase 3, but sustainability is part of the discussion from the very beginning. Thank you.
A final point here is one of the messages, that message probably was one of the most, if not the most visible, because it was mentioned by other philanthropic organizations too, was have your business case together when you come to the door. Have explored the mission of that organization and have your business case together.